Filtek Supreme XTE Universal Restorative. This animation demonstrates how to create posterior restorations using a dual shade technique. For dentists who want to create more aesthetic posterior restorations, 3M ESPE recommends a dual shade technique using a body or dentin shade, along with an enamel or translucent shade of 3M ESPE Filtek Supreme XTE Universal Restorative. Prepare for the procedure by first determining the patient's tooth shade, using the VitaPan Classical Shade Guide. Then, select matching shades of composite using the Filtek Supreme XTE Universal Restorative Shade Selector as a guide. Prepare and isolate the tooth. To help protect against microleakage and further reduce the risk of postoperative sensitivity, you may choose to apply a liner base. Mix 3M ESPE Vitribond or Vitribond Plus Light Cure Glass Ionomer Liner Base. Apply a thin layer to the dentin surfaces and light cure. Now place the adhesive. Follow the bonding instructions provided in the instructions for use of the adhesive system you have chosen for this restoration. To ensure good adaptation, you will first place the chosen dentin or body shade in a 1 mm increment in the proximal box and on the floor of the cavity. Light cure. The recommended cure time for a 2 mm increment of body shade is 20 seconds. However, the recommended cure time for darker body shades A6B or B5B or for dentin shades is 40 seconds per 1.5 mm increment. Continue placing the chosen body or dentin shade in increments to the dentin enamel junction. Use the remaining coronal tooth structure as a guide for placement and adaptation. Light cure after each increment. After curing the dentin or body shade, you will place and cure the chosen enamel or translucent shade in increments. Use the remaining coronal tooth structure as a guide for placement and adaptation. Overfill slightly. Light cure after each increment. Finish and polish the occlusal surface using an appropriate finishing instrument. Finish the interproximal surfaces with 3M ESPE Softlex finishing strips and Softlex extra thin polishing discs. Finally, check the lateral and centric occlusion and adjust the restoration as necessary.